Welcome to this presentation that we are holding to introduce you to our recently launched serial prescription toolkit. We hope that this session will provide you a high-level overview of the toolkit and help support you with the introduction of serial prescriptions within your practice. Thank you for accessing this recording. Firstly, next slide, please. Before we go any further, I'd just like to introduce you to our presenters for this session. So I'm Leslie McFarlane, the Senior Improvement Advisor who has been leading the Pharmacotherapy Collaborative before and during the pandemic. I'm joined by Graham Gould, who is our GP Clinical Lead, and Mark Easton, who is our Pharmacy Community Clinical Lead. We also have Adeline Tan, who's our Improvement Advisor, and Debbie Kelly, who is our Admin Officer. Also very privileged and delighted today to have Laura Wilson, who's the Policy and Practice Lead at RPS, and Dr. David Shackles, who's Joint Chair at RCGP, going to contribute to the session. With that, I will hand over to Adeline.
Hi, let me begin by talking about the background to the Serial Prescription Toolkit. The Serial Prescription Toolkit has been developed to support primary care services, build resilience, and deliver high-quality care. Transferring suitable patients to serial prescriptions ensures medicines-related activity is dealt with by the right member of the pharmacy team at the right time, safely and efficiently. Effective serial prescribing can improve practice resilience by reducing GP practice and pharmacy staff workload and enhance patient outcomes and the overall care experience for people, families, and staff. The aims of this presentation are to support multidisciplinary practice teams to set up or review existing serial prescribing processes rapidly, provide a high-level overview of toolkit and functionality, demonstrate to practice teams the tools and resources available for them to assess their current processes and safely introduce new ones, as well as to offer an opportunity to ask questions and assess further bespoke support to facilitate the setup or review of serial prescribing processes. A series of bite-sized recordings will soon be available on our pharmacotherapy website. Next slide, please. Over our 4 serial prescription toolkit webinars held in October, we had about 355 attendees, and the stars on the map show the spread of our attendees. Next slide, please. This is the general list of relevant job titles of those who attended, and not every job title is listed there. So before we go into any more detail regarding the toolkit, I'm going to hand over to Dr. David Shackles, the Joint Chair of RCGP, for some of his thoughts and insights regarding the use of serial prescriptions. Dr. Shackles, please. Next slide.
Thank you very much, and thank you very much for inviting me to speak at this webinar. RCGP Scotland is delighted to support this serial prescription toolkit. It really is an excellent resource, pulling together all of the information, the tools and the supports that practices need to help transfer patients over to serial prescriptions. It really does encourage quality prescribing at all the stages of the process, and this leads teams through the quality improvement methodologies that are going to help and encourage the successful implementation. We all know the pressures that practices are under at the moment, and although this isn't going to solve all our problems, it is a real positive step, and hopefully maybe one of the stepping stones towards full implementation of e-prescribing. But more than that, as well as helping GP teams' workload, it's also going to encourage relationship building with our pharmacist colleagues. That's both working in the practice with the GMS pharmacotherapy, but also relationship building with our community pharmacies, and that can only be a benefit to the whole system. Hopefully, the increased use of serial prescribing will help to smooth some of the workload pressures that our community pharmacy colleagues are suffering from as well. It's become really clear to me in my own practice that patients can benefit from serial prescriptions as well, both in the convenience of them, but also in the prescribing quality, the quality of the medication reviews and the system and the process that it puts in place. My own practice team have really benefited greatly from a lot of the resources that HIS have made available to us, both in helping the system efficiency and the effectiveness of the system as well. And I'd really like to thank Healthcare Improvement Scotland for their commitment to this work and for pulling together all the expertise from around Scotland to make it happen. So thank you very much.
Thank you, David, for your kind words, and really nice to hear, you know, a GP talking about how the introduction of serial prescriptions has benefited them within their own practice. So before we dive into the toolkit, let's just clarify what we mean by serial prescription. The definition on the slide shown is adapted from the NHS Medicines Care and Review Service at your local pharmacy. It provides a comprehensive and meaningful way of describing the definition. Serial prescriptions are a key element of delivering coordinated, person-centred care and support so that the right patient gets the right medication at the right time, and that this is also managed by the most appropriate member of the team. When transferring to serial prescriptions, it's essential that you test your new processes, ensuring that they're safe and improve quality both for the practice and for the patients. Using serial prescriptions can be more convenient for patients. It can reduce unnecessary footfall and phone calls to the practice. Thereby, it can reduce workload within the practice, and it also supports community pharmacy to better coordinate and manage their own workload. Next slide, please. When we initially started work on the Pharmacotherapy Collaborative at the end of 2019, but then we had to put the programme into hibernation, and when we remobilised after the first lockdown, the feedback that we were hearing from the systems that was a focus on implementation of serial prescriptions would be the most useful improvement support offer that we could offer to support practice teams. So between November 2020 and March 2021, we worked with 53 GP practices across 8 health and social care practices, 8 partnerships in Scotland to develop and test new and existing practical guidance and resources. The resulting toolkit that you see on the screen is a combination of the National Medication Care and Review, co-produced iHub resources and local resources. We're absolutely delighted as well that we've had RPS endorse the toolkit, and we're also currently working with our CGP through their endorsement process, and hopefully we'll have that endorsement to add to the toolkit in the near future. So the toolkit as it stands is an interactive PDF and is designed with a cycle with 5 key stages. These are planning for the serial prescribing process in your practice, selecting your patients, setting up your serial prescribing process, discussing serial prescriptions with your patients, and how to start dispensing the serial prescriptions. At the centre of the implementation circle are the quality improvement tools, which are invaluable to teams as they test and introduce new processes. It's fair to say, though, that GP practices across the country will all have varied serial prescribing processes and experiences, and therefore will want to access the toolkit at different stages. And it's been set up in such a way as that you can click on the icon that are circled in red that will take you to the relevant page. The toolkit consists of 9 slides in total, so you can scroll through it or you can jump about as need be to the appropriate section. Next slide, please. Once you click on your required icon, in this case it's how to set up a serial prescription, it brings you to this page, and what you see is a suite of resources in front of you. and the same format exists for every page within the toolkit. The page is divided into purposes and resources so that you know what resources are available for each element. There's also the resources have been categorized into guidance, tool and training, and in the top right hand corner there's a key that shows you which is which, and the resources that are in bold text are actually the ones that we've highlighted and flagged as what we think is an essential resource to help you implement this process. Some of the slides also have good practice statements. So, for example, on this slide, there's a good practice statement that says, take care to read code accurately. And at any point, once you've looked at the resources, if you want to go back to the home page, you just click the icon on the right-hand bottom of the screen. Next slide, please. So what we're sharing here is some of the data from the teams in the collaborative, which they have extracted from Stu. Now, how to use Stu and extract that data with Stu, the links are in the toolkit, as is the reporting template that would pre-populate the run charts for you. But I think those slides just show that actually when you put the implementation support and you invest on introducing serial prescriptions within your practice, that you can sort of at a reasonable pace gain some traction around increasing the uptake and use of them. So what now I'll do is I'll pass you to Graham and Mark to take you through the stages of the toolkit, and we'll hear from David and Claire, David and Laura as we go on. Thank you.
Next slide, please. Welcome everybody to our webinar. I'm Graham Gold and I'm going to go through the first step in our serial prescription toolkit. So in step one, we're asking, what does your team already know about serial prescription? You might sense that some team members are worried about serial prescriptions. For example, are they concerned that they may be expected to make clinical decisions out with their scope of practice? Training is also a need that's often raised by team members in order for them to feel equipped and confident to deliver safe and effective serial prescriptions. It's worth investing the time to ask what support they feel they need and attending to this before getting started. Think about what factors or needs might be holding your team members back. One way of doing this is to do a process map, and I'd certainly recommend and encourage doing a process map in your practice if you haven't already done this. Next slide, please. Awareness and understanding of the process of serial prescribing is fundamental to delivering improved outcomes for the GP practice, community pharmacy and patients. As a practice team, you must be ready to implement the changes with regard to culture, resource, staffing and training. Understanding how others have managed serial prescribing can be enlightening, as you may have concerns others have already overcome. After much team discussion, key documents were chosen as vital to the planning stage indicated. For example, benefits and tips for introducing serial prescribing is for practices that are just starting on their journey, to help provide an overview of the process and create awareness amongst your team. Other national resources include the journey of a serial prescription, introduction to serial prescriptions for GPs and practice staff, the administrative housekeeping guide for vision, and flowchart for medicines care and review or MCR process in EMIS practices. Don't worry, these are all available in guidance in the toolkit. We also have the serial prescribing overview for vision practices and the serial prescribing case study to help your team move forward at pace. Next slide, please. We want you to consider the readiness of your team for implementing serial prescribing. Here you'll see the vision and EMIS training checklists, And these are two key documents in assessing your team's needs with regard to the culture, systems, staffing and training already mentioned. The readiness checklist for serial prescribing and frequently asked questions for general practice are guidance to support your assessment processes. Next slide, please. A smooth implementation of serial prescribing involves clear communication across all parties involved. And those involved within the GP practice must understand their roles and responsibilities. We have developed two quick guides, one for general practice and one for community pharmacy. We also have an example of a shared care agreement, and this encourages community pharmacists and patients to be involved in the changes being implemented. It provides a structured template for practices and community pharmacies to ensure everyone takes responsibility for their own function within the process, and it can be used for future reference. Before I hand over to Mark, I'd just like to ask David and Laura for any additional comments.
Yeah, thanks very much, Graham. Absolutely endorse what you've been saying about the importance of planning at the early stages. I think we were in our practice a fairly early adopter of serial prescribing, but we spent a long time, I mean, several months discussing the process before we got started with it. And I think that was really time very, very well spent. And some of the time was actually spent holding back some of the keener people to make sure we got the processes absolutely right. So we ran whole team events, and then we had some smaller team events so that everybody understood what all the processes were before we kicked off with it. And I guess it came, you know, the reason for doing it is that everybody in the practice realized we had to do something about prescribing about the workload and the volume. And this was, you know, 3-4 years ago. And so it was driven by the admin team and by several keen GPs, but also by the pharmacist as well. We found that working with one of our local community pharmacists who was keen to get things going was very helpful as well. So we just started it reasonably gradually and then built on it. But planning was key, absolutely.
Thanks, David. I think it's absolutely essential to involve the whole team, and that's a good reminder to involve the community pharmacist as well.
And just from my point of view, I think familiarising yourself with all the tools that you have available to you, so that when you do sort of start out, you know exactly where to get that help and information, and you're not held back by having to go and seek questions or answers to questions that you've got that are already available. So making sure that you are familiar with everything that's there to help you.
Yeah, that's a good point, Laura. Thank you. Okay, I'll hand over to Mark now.
Thank you, Graham. Next slide, please. So for step 2, we're looking at how we select our patients. So this is about looking at how we identify suitable patients within your practice to establish who can be moved onto serial prescriptions. So you need to think about how you'll start to identify potential patients in terms of screening or clinically reviewing them, and also how you'll set aside time to identify those. Next slide, please. Selecting your suitable patients is a crucial step in implementing serial prescriptions successfully. First of all, you need to think about agreeing the inclusion and exclusion criteria within the practice. So not every prescription can be produced as a serial prescription, and not every patient is eligible for this service. Some exclusions are set by statute, such as Schedule 2, 3 or 4 controlled drugs, but others may be more flexible and subject to change over time as your expertise within serial prescribing improves. For example, with when required or PRN medicines. So your initial exclusions may change as you become more comfortable with the service, and then you'll see opportunities to extend it and maximise the benefits to the patients and the practice. The inclusion and exclusion criteria developed by some other teams may help you form some agreement within your initial practice discussions. Next slide, please. So selecting patients and identifying the potential patients involves several steps. Having identified your suitable patients, you'll then need to screen them for inclusion. Your local community pharmacies may provide a useful source of information for suitable patients, but our key resource here that we would point you to is the Scottish Therapeutics Utility, or STU software. And this is highly recommended and has been very, very useful in providing searches for patients on your database to establish a cohort of potentially suitable patients. So to be clear, there's a difference between suitability identification and screening for inclusion. The two key documents we would point you to are called SR01 and SR04, and they are running a search for suitable patients in EMIS or vision, and they're specific pieces of guidance and tools for vision and EMIS practices respectively to assist in identifying suitable patients. Next slide, please. Patients who have been identified from your database search must now be screened for suitability, and the details forwarded to the appropriate staff for creation of a serial prescription. So you create a cohort of potential patients and you apply your previously agreed inclusion/exclusion criteria to this cohort to identify which are suitable for a serial prescription. Now, selecting those with a preferred community pharmacy should make the implementation and the communication a little bit easier. Once you've identified suitable patients, you would need to screen them using the inclusion criteria you had previously agreed, and the tools here that we point you to are SR02 and SR05, screening a database search in EMIS and producing a serial prescription in Vision. And these will provide practical help and are found in the toolkit. You'll notice here that we have a good practice point, and we note that it's possible that changes in the processes may impact negatively on people with specific needs or protected characteristics. So you should take this into consideration when you're selecting suitable patients to identify recommendations that mitigate any potential negative impact on specific groups. I'd now like to ask if David or Laura have any additional comments they'd like to add to that. David first.
Yeah, thanks very much, Mark. Nothing particularly additional to add in. We certainly started off as an early adopter with this without the benefit of STU. So we started working with one of our community pharmacists who was very good at identifying patients for us. People who would attend regularly, people who she'd had discussions with, maybe on easy to manage medication regimes like levothyroxine or stable antihypertensives. And then gradually, as we got confident, we started involving our admin team in doing some screening as well. And now we've moved on to using the STU screening for finding more patients who are available as well. But absolutely emphasize the fact that it needs to be done thinking about patient acceptability and working with your patients as well to make sure that that they're going to find it acceptable and they're involved in the process as well. Thank you.
Thank you, David. Yes, and a great example there, I think, of learning as you use the service and developing the service according to your ability. Laura, anything to add?
Nothing particularly much, just use other people. If you're struggling to identify what patients you want to include or your criteria, then speak to people who've already done it and have had success doing it. You'll learn a lot from them and some of the challenges that they've faced. And really just when you're deciding what patients to include, make sure you really take that kind of patient-centered approach. As David said, people who attend regularly are really great at candidates for it, but somebody who maybe struggles with their medication might not be such a good candidate. So make sure that sort of patient-centered approach is really taken when you're deciding who to include.
Great, thanks, Laura. And again, the key point there, I think, is about working together as a team and sharing all the resources that are out there. I'm now going to pass back to Graham for step 3.
Thanks, Mark. Next slide, please. Okay, so step 3 is setting up a serial prescription. What we'd like you to think about is how you will start to identify the key people in your practice that will take the lead for setting up your serial prescribing process. Think about your current workflow. Are there any steps in your process that need changed in order to accommodate the serial prescribing? Have you considered who in your practice will be responsible for the section of serial prescription production? Next slide, please. A crucial part of setting up a serial prescription is to change your records and produce a serial prescription. Once your screening process has identified a suitable patient, their medicines can be transferred to a serial prescription. Take care to read code correctly at this stage. And you'll see on screen the read code 66RE. Other useful tips are considering your preferred option for most patients, and this should be an 8-week dispensing interval on a 56-week prescription. Also consider staggering your serial prescription initiation over the next few months so that subsequent review workload is spread out more evenly throughout the year. Key documents are SR03, which is switching a repeat prescription to a serial prescription in EMIS, and SR05, producing a serial prescription in Vision. And these will help the appropriate staff through this part of the process. Next slide, please. Printing and sharing a serial prescription. Hopefully now your serial prescription is ready for this to be printed and signed according to your agreed practice workflow. The prescription should also show the preferred community pharmacy for onward distribution. Previous engagement with the community pharmacy using the serial prescribing joint care agreement and using the joint working agreement discussion points will help create a smooth transition. Patient information letters can also be printed at this stage for distribution by appropriate staff, either directly to the patient or via the community pharmacy. So at this stage, I'd just like to ask David and Laura for any comments before we hand back to Mark.
Yeah, thanks very much, Graham. Yeah, absolutely. We identified within our team both an admin prescribing champion who would sort of liaise with all the other admin staff about any problems or issues. But we also had a lead GP who was driving along the process with the GPs and really making sure that all the GPs were appropriately trained and engaged in the process as well. But that helped. So you had a core team leading the process to make it work well, and they work very closely with our practice pharmacist. And I think that the point, it is really important to try and make sure that your reviews are spread out and it's not all coming in a big batch. I think that's important both for making sure our workload is manageable, but also making sure that the GPs then engage in good medicines management and encourages much better, more effective medicines reviews. And I guess we'll come to that later on in the process. Thanks.
Yes, thanks, David. I think that's a good highlight around champions and leads and who the go-to person should be within the team. And you're right, we will be coming to appropriate and safe review of medicines. Laura?
I really like David's suggestion of champions in each area. I think that really gives somebody responsibility who knows that particular part of the system and to come up with good ideas. I think as well, don't be afraid to tweak your process if you find that it's not working or things change. You might not get it absolutely perfect or spot on first time round, but don't be afraid to make those changes to make it work for the whole team.
Yes, I would agree with that, Laura. Look at the process, tweak it, make small changes and improvements as you go along. Okay, thank you very much, and over to Mark.
Thanks again, Graham. And just to reiterate, without saying anything in addition to what's just been added there, the tools that you have in the toolkit include lots of QI tools to support exactly what Laura had been alluding to. So step 4, how do we inform our patients? So step 4 is if we will look at letting suitable patients within the practice know that we're moving them onto a serial prescription. So you need to think about how your patients know about the new process, and also think about what else you advertise in terms of your service changes to patients and how you currently promote those services. Next slide, please. So discussing this with the patients. And it's important that our discussions with the patients are person-centred, as there may well be a potential to frame discussions as a process-centred conversation. Now, the key elements of this discussion should be about how it can benefit the patients. Clear and effective communication with the patients will be key to an efficient transfer from repeat to serial prescribing. And the two documents on screen are our key documents. They're the person-centred discussion checklist, which is your key document to help you around the initial discussions, and also at review stage, particularly the first review. The other key document here is entitled Questions to Prompt a Person-Centred Discussion, and this can be used to facilitate your discussions with your patients. I must highlight that this step may happen at more than one place in the process, depending on the specific purpose of your communication. Next slide, please. Written communication. It is good to provide the patient with a patient information letter or leaflet, and this informs them of the basic changes to the system. Now, the written communication may also offer reassurance around areas of their care which are unchanged, but may be of concern to the patients, such as their ability still to see their GP. Next slide, please. A good practice point here is to highlight that when undertaking a large-scale move to serial prescriptions, you should consider at an early stage how to discuss with and inform the patients of these changes, as it has already been highlighted in the discussions today. I wonder now if David and Laura would like to come in and support anything we just said there.
Yeah, thanks, Mark. Absolutely agree that the discussions with the patients are really, really important to make sure they're fully informed and they don't get any surprises about things. So in the good old days, we used posters in the surgery practice when footfall was higher. Now we've moved on to much more digital ways of informing using our website and Facebook page as well. But we're also now getting to the stage where with over 20% of our patients on serial prescribing, word of mouth between patients is actually encouraging people to start the conversation with us. So we're finding that patients are now initiating the discussions. And also with the increasing amount and the community pharmacists knowing that we're involved with serial prescribing, they're initiating the discussion when patients go into them as well and sending them back to us to follow up the discussions there as well. So we're finding it's really sort of gathering a little bit of momentum, which is really helpful. And I think it has to get to a little bit of a tipping point for that to happen. So putting in the work early, getting the discussions done well and effectively to start it off is time well spent.
Thank you, David, and that sounds like a real good news story. Laura, anything to add there?
Not particularly. I think just really that communication is vital, making sure you reiterate that the patients can still contact their surgery, see their GP or any surgery staff if they need to, and just making sure that they do know that. I think a lot of patients are fully supportive of the whole system, the whole process, if they know that and their concerns are addressed. So yeah, just the communication's got to be good from the start.
Excellent. Thanks, Laura. Okay, back to Graham now for step 5.
Thanks, Mark. Yep, step 5. You'll be glad to know this is the last step, and it's how to dispense a serial prescription. So we'd like you to consider how you're currently managing your dispensing updates and your treatment summary reports in your practice. Next slide, please. Once the serial prescription arrives at the community pharmacy, one of the pharmacy team will explain how the dispensing process will work for the patient and agree dual consent. Any questions they may have at this stage will be addressed. The frequently asked questions for community pharmacy provide a range of answers to some of the concerns about the dispensing process. The GP practice will receive an electronic notification every time a claim for dispensing is made against the prescription, and a treatment summary report or TSR on completion, requesting a new prescription. The guide to processing treatment summary reports will help your admin staff generate TSRs. A TSR is a key document not only for requesting the next serial prescription, but also for communicating clinical information relating to the serial prescribed items, and it includes a care of summary. It should be considered as a clinical document rather than a prescription request form. As TSRs are embedded into existing processes, there is opportunity to use this information to enhance annual medication reviews, as mentioned by David in our earlier discussion. Next slide, please. In an ideal world, the ongoing management of the TSR should be a great prompt to renew a serial prescription and also to stimulate the ongoing medicines review process within the practice. This should be done in a safe and time-protected manner, and we would encourage practice to aim for this scenario. The Track Your Prescriptions tool is a tool that allows your practice to track your serial prescriptions, and for this you require a SWAN physical app token to log in. A SWAN token is an NHS authentication to allow you access to your health board's shared drives. If you do not already have a SWAN token, contact your health board's eHealth department. David and Laura, any further comments on the dispensing of a serial prescription?
No, Graham, I think that's pretty clear. I think it really is important to emphasise what an important document the TSR is, and to make sure that staff really understand how to process it when it comes in. And I think you're absolutely right to emphasise it really is a clinical document. It needs to be the GPs that see it. Sometimes what we've done now, if there's problems with that, any difficult ones, we pass on to our pharmacy team, who are really great at troubleshooting if there's difficulties around it. But we very much involve our GPs in this for the reauthorisation process and taking that time for doing the medication reviews.
Thanks, David. Yeah, I mean, the reauthorisation process has always been a slightly thorny subject, but I think if it's coordinated with doing a medicines review, then that's the ideal way of doing it. And again, just to see if we can do that in a safe, protected manner, then that would be the gold standard. And Laura?
No, nothing particular to add. I think you were quite clear, you know, and especially about the importance of the document.
Thanks, Laura. Okay. I'll now pass over to Adeline.
Next slide, please. So this is a suite of QI tools that you can freely access to support implementing your serial prescriptions. We've only highlighted some of the tools today. A driver diagram visually presents a team's theory of how an improvement goal will be achieved. A process map helps the team visualize your serial prescription process. PDSA stands for Plan, Do, Study, and Act. PDSA cycles are an ideal QI tool that can be used to test an idea by temporarily trialing a change and assessing its impact. A data measurement plan sets out details for each measure proposed for an improvement project, and the data collection template helps you to collect appropriate data for informing your work. The link to NAS QI Zone, where more information on how to use the QI tools, is in the Serial Prescription Toolkit. You may have your local QI support team. These specialists can help you understand these QI tools more in depth. The other local specialists you may be able to call on is your local eHealth facilitators. They can also help support your implementation of Serial Prescription Toolkit. And now I'm delighted to pass this over to Laura Wilson, Practice and Policy Lead with the Royal Pharmaceutical Society, for some closing remarks. Laura, next slide, please.
Thanks very much, Adeline. Next slide, please. So I just want to start with a huge thank you to everyone who has been involved in the creation of this really excellent toolkit for serial prescribing. It's a toolkit that we, RPS Scotland, as the pharmacy's professional leadership body, are really supportive of, and I thought it might be useful to explain the background as to why that is. At the start of this year, we were contacted by pharmacists who wanted to see some improvements to the pharmacotherapy service. So we undertook some work initially with the RCGP and then subsequently with the BMA, and the output of that work was a joint BMA RPS statement in which we recognise the progress that has happened to date on delivering the pharmacotherapy service, but also the challenges that remain. In particular, we called for better use of IT, improved IT, reducing the administrative burden, effective team working and better processes. Very specifically within the document on serial prescribing, the statement says, serial prescribing is a good idea. Where it works, the ability to move stable repeat medication onto an annual prescription avoids significant time spent on processing repeat prescriptions. However, we all know that these benefits are not being maximised. So the statement carries on. We recommend the issues should be fully explored, learning shared from practices where it is working, and solutions to improve the functionality and efficiency of the system developed. Next slide, please. So that last point about the need to share learning from practices where serial prescribing is working is why I'm here today. In the corner of the toolkit, you'll see it's been endorsed by RPS. And we chose to do this because we want to see serial prescribing working. And we think that by sharing the learning that is within this toolkit, it's an important step in enabling other teams to use serial prescribing. We absolutely hear the concerns that it takes time to make the change and no one has any time right now. But we also hear from teams who are working more efficiently as a result of moving people onto serial prescriptions. And that improves workflow and smooths out some of the current pressure points in the system. And we hear that both at general practice end, where it reduces repeat prescription handling, and also at the community pharmacy end, where it enables workload to be smoothed out over the day and week. So yeah, maximising serial prescribing is an investment of time to get it working, but it's an investment that will help workload in the longer run. And given the workload pressures that all of healthcare face right now, that's a good thing. So I would absolutely encourage you to consider how the toolkit can help you increase your use of serial prescribing. And finally, thank you again to his and to all the teams involved in creating this toolkit.
Thank you for those comments, Laura. So I think that just leaves me to close the session. I would like to thank everybody for their support in developing and launching the Serial Prescription Toolkit. Many thanks to Graham, Mark, David and Laura for taking us through the toolkit today and really insightful comments around their own experiences and advice, which has been invaluable. My colleague Eloise Johnson, she is leading on the serial prescription work moving forward and is currently developing a series of more detailed digital workshops on the implementation of serial prescription within your practice. These will shortly be published on our website, so please keep an eye out for them. So thank you for taking the time to listen to this session. If you have any queries, please don't hesitate to contact us on the email shown on the screen. And with that, I will say goodbye.